Hello everyone and welcome to my channel. Today in this video we will discuss about stomach ulcers. Stomach ulcers, also called as gastric ulcers, are open sores that develop on the lining of the stomach. Ulcers can also occur in part of intestine just beyond the stomach, which are called duodenal ulcers. Both gastric and duodenal ulcers are sometimes referred to as peptic ulcers. The most common symptom of a stomach ulcer is a burning pain in the center of the abdomen. But gastric ulcers are not always painful, and some people may experience other symptoms such as indigestion, heartburn, and feeling sick. You should visit your doctor if you think you have a stomach ulcer. Seek urgent medical advice if you experience any of the following symptoms like Number 1. Blood and vomit. The blood can appear bright red or have a dark brown, grainy appearance similar to coffee grounds. Number 2. Passing dark, sticky, tar-like stools. Number 3. A sudden sharp pain in your abdomen that gets steadily worse. These could be a sign of a serious complication such as internal bleeding. Stomach ulcers occur when the layer that protects the stomach lining from stomach acid breaks down, which allows the stomach lining to become damaged. This is usually a result of Number 1. An infection with Helicobacter pylori, that is H. pylori bacteria. Number 2. Taking NSAIDs, that is non-steroidal anti-inflammatory drugs such as ibuprofen or aspirin, particularly if they are taken for a longer time or at higher doses. It used to be thought that stress or certain foods might cause stomach ulcers, but there's little evidence to suggest this is the case. It's not known how many people have stomach ulcers, although they are thought to be quite common. Stomach ulcers can affect people of any age, including children, but mostly occur in people aged 60 or over. Men are more commonly affected than women. With treatment, most stomach ulcers will heal within a month or 2. The treatment recommended depends on what causes the ulcers. Most people will be prescribed a medication called as proton pump inhibitor to reduce the amount of acid their stomach produces and allow the ulcer to heal naturally. If an H. pylori infection is responsible for the ulcers, antibiotics will also be used to kill the bacteria, which should prevent the ulcers coming back. If the ulcers are caused by the use of NSAIDs, PPIs, that is proton pump inhibitors, are usually prescribed, and your doctor will discuss whether you should keep using NSAIDs. Alternative medication to NSAIDs such as paracetamol may be recommended. Stomach ulcers can come back after treatment, although it's less likely to happen if the underlying cause is addressed. Complications of stomach ulcer are relatively uncommon, but they can be very serious and potentially life-threatening. The main complications include Number 1. Bleeding at the site of ulcers, that is hemorrhage. Number 2. The stomach lining at the site of the ulcer splitting open, that is perforation. Number 3. The ulcers blocking the movement of food through the digestive system, which is called gastric obstruction. I hope you like this video. Thank you for watching.